Okay, so given that it helps your back pain to bend forward, I'm going to show you a couple stretches that may help. Okay, so here's the first one. The first one would be sitting in a chair, like a kitchen chair, and this with the kitchen table. What you can do is you can kind of slide out like this. You want to be like this, and then take a deep breath in, rounding your lower back. You would hold for about 30 seconds. Obviously, you'll have to breathe in between. But stay in the position for about 30 seconds. And dip your head. You would try that. So it might be a little bit uncomfortable on your incision, but it's not going to hurt your incision in terms of like any sort of damage. You just need to make sure that it's continuing to not ooze or do anything weird like that. Okay? The second one is very similar. You would get your legs really wide on the chair. And then what you're going to do is you're going to kind of put your elbows down like this. If you can go all the way down like this. Once you're here, you can try and walk your hands over to one side and over to the other side, holding about 15 to 30 seconds. Now, when you go to sit back up, you want to put your hands on your knee and actually push, okay? Now, it may be uncomfortable, again, with your incision to go down that far, so you can just kind of be in this position again. You can see which one of these two might work better for you, but really what you're doing is you're opening up your lower back right in this area, okay? Which is the lowest lumbar segment in your back. And a lot of times people who have this end up with pain kind of right in here, really centrally, okay? So I'll show you two laying down stretches that you can also try. Okay, so when you're lying in bed, what you would want to do is you can try bringing one knee up and hugging it, holding again for 30 seconds. I'm going to turn this way a little bit. You might be able to see a little bit better. And then try the other for 30 seconds. If you get good at this and it's not bothering your incision too much, you can do two legs, but make sure when you do, you don't pick them up like this because that's a lot of abdominals, which will hurt. You would do one, then the other. You can try and hug like this. When you get really good at it, pick your head up a little bit, okay? So again, it's all 30-second holds. 3 to 5 times. You can do it multiple times a day. So then the last one is again lying down. The tile floor is cold. Lying down, you can let your legs go all the way over to one side. Again, you will feel some pulling. As long as you're not pushing into pain, it should be okay. 30 seconds. Just kind of let gravity take your legs. 30 seconds. So there's 4 different stretches you can try. You may find that one works better than others in terms of helping your back, as well as in terms of not bothering your incision. So try that for now and report back to me. Okay?